When assessing the sensory system, plan to evaluate the patient's sensations of pain, temperature if indicated, light touch, vibration, position, and discrimination. Begin the sensory examination by assessing pain sensation in arms, legs, and trunk. To do this, first warn the patient. Then use the sharp end of a broken cotton swab stick, a previously unused safety pin, or some other suitable tool. Ask the patient to close his eyes. Then, starting with the arms, test scattered areas, occasionally substituting the blunt end for comparison between sharp and dull. Compare sides and distal and proximal areas. Continue the evaluation of pain sensation with the legs.
Sharp, dull, sharp, sharp.
Next, test the anterior trunk.
Now I want to fold your gown down. Just scoot up a little bit here. Pull your arms out of it. Okay, put your arms right back here at your side. Same thing, just tell me sharp or dull. Okay.
If you detect any abnormalities, evaluate the posterior trunk.
Dull.
If pain sensation is abnormal, test the patient's response to temperature.
Sharp.
All right, good.
Next, assess light touch with a cotton wisp. Check the patient's arms and leg.
All right, close your eyes again. Now I'm going to touch you with this cotton swab to check light touch. If you feel it, you say now. Are you ready?
Yes. Now. 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 Now.
Then check the
Now.
patient's trunk.
Now.
Does it feel the same
Compare sides.
here and here?
Same.
Is this side the same as this side?
The same.
And compare distal with proximal areas.
Same as this?
Same.
And this? The same as this?
Same.
Next, assess vibratory sensation using a lightly vibrating low-pitch tuning fork.
All right, I'm going to test vibratory sensation next. Close your eyes again.
Have the patient close his eyes, then place the vibrating fork firmly over the finger pad
What do you feel?
and ask the patient to
Vibration.
tell you what he feels. Ask the patient to tell you when the sensation stops. Then stop the vibration.
It'll stop.
Okay,
Now test the patient's other
right
hand.
over here.
Normally, vibratory sensation is intact distally. If it is diminished, proceed to more proximal areas, such as the forearm.
Okay, now.
When assessing vibratory sensation of the lower extremity, start with the big toes. Compare size. If vibratory sensation is diminished, check more proximal areas.
In this foot, you feel
Keep in mind that distal vibratory sensation may normally decrease with age. For the next part of the exam, test position sense.
Next, I'm going to test position sense in your feet.
Hold the sides of the
and in your
patient's
hands.
big toe with your thumb and index finger. Avoid touching the other
Move
toes.
it up,
First, move the toe up and down,
left.
identifying each position as the patient watches.
You close your eyes and tell me
Next,
which direction it goes.
ask the patient to close his eyes and identify the direction of motion.
Left.
Move the big toe up and down in an irregular sequence. Then compare with the big toe on the other foot.
Same thing. Are you ready?
Yes.
Here it comes.
Up. Down. Right. Left.
Left.
In a similar fashion,
And that's
again with
right.
the patient's eyes
Close your
closed,
eyes.
test position sense in the upper extremities using a finger on each of the patient's hands.
Down. Left. Right.
Finally, test discriminative sensations by assessing stereognosis or object identification, which is the primary test. If necessary, also test number identification, 2-point discrimination, point localization, and extinction. You will perform each of these tests with the patient's eyes closed.
Keep your eyes closed. Now hold out
To
your
test
right.
stereognosis, place a familiar object in the patient's hand and ask him to identify it.
Feel that object and try to identify it.
It feels like a coin.
Good.
Repeat the procedure on the other hand using a different object.
Feels like a key.
Good. You can open your eyes now.
To test graphesthesia, or number identification, use a blunt object to draw a large number on the palm using a single continuous stroke.
Now I'm going to test number identification. Close your eyes. And on the palm of this hand, I'm going to write a number facing you, like on the chalkboard. You tell me what it is.
The number should face the patient, not the examiner.
3.
Right.
Test one palm, then the other.
Now the same thing in this hand. Tell me what this number is.
A 5.
2-point discrimination is tested by asking the patient if his finger pad has been touched in one area or two. Using two ends of an opened paper clip or the ends of two pins, repeatedly touch the patient's finger pad with the 2 points at the same time and with 1 point occasionally. Be careful not to cause pain.
This paper clip. I'm going to touch your
Ask the patient to identify if he's being touched with 1 or 2 points. Then reduce the distance between the points so that you can determine the minimum distance at which the patient can identify 2 points. On the finger pad, the distance should be less than 5 millimeters.
2. 1.
I'm going to do another test of sensation now. Let me fold
To
you
test
down.
point localization, touch a point on the patient's skin. Then ask him to open his eyes and point to the place touched.
Put your hands right here. I'm going to touch you on a part of your body with your eyes closed. After I do, then you open your eyes and point to where I touched you. Are you ready?
Yes.
All right, close your eyes. Okay. Where did I touch you? Close your eyes again.
This test is especially helpful on the trunk and legs.
Where did I touch you? Correct. Okay, close again. Where did I touch you? Now I'm going to touch you on your left side, your right side, or both. And you tell me whether it's left, right, or both.
Okay.
Ready?
Yes.
Close your eyes.
To test double simultaneous stimulation, use your fingertips to provide stimulus on either one area of the patient's body or in two areas simultaneously. Normally, the patient should be able to identify whether your stimulus was on one side or on both sides.
Both.
Good.